What is the position of the tibia relative to the fibula? Medial, anterior, lateral, or posterior? Medial. The tibia forms the medial border of the lower leg, while the fibula runs parallel along its lateral aspect. How is the common carotid artery positioned relative to the internal jugular vein? Lateral, medial, posterior, or anterior? Medial. Within the carotid sheath, the artery lies medial to the vein alongside the trachea. What is the position of the spleen relative to the stomach? Superior, inferior, lateral, or medial? Lateral. The spleen is situated laterally to the stomach, meaning it is positioned to the left of it, away from the body's midline. What is the position of the gallbladder relative to the liver? Medial, superior, inferior, or lateral? Inferior. The gallbladder rests in a fossa on the visceral surface of the liver's right lobe. What is the relationship between the femoral artery and femoral vein? Posterior, anterior, medial, or lateral? Lateral. Within the femoral sheath, the artery occupies the lateral compartment relative to the vein. How are the lungs positioned relative to the heart? Lateral, superior, inferior, or medial? Lateral. Each lung lies on the lateral side of the mediastinum, enclosing the heart. What is the position of the duodenum relative to the stomach? Superior, inferior, posterior, or anterior? Inferior. The duodenum continues from the pyloric end of the stomach, forming a C-loop around the pancreas head. How is the sciatic nerve positioned relative to the piriformis muscle? Inferior, posterior, superior, or anterior? Inferior. The sciatic nerve typically exits the pelvis through the greater sciatic foramen below the piriformis. How are the adrenal glands positioned relative to the kidneys? Inferior, superior, lateral, or medial? Superior. Each adrenal gland caps the superior pole of its corresponding kidney. How is the subclavian artery positioned relative to the subclavian vein? Superior, inferior, lateral, or medial? Superior. The artery arches over the first rib superior to the vein as they enter the upper limb. How are the semimembranosus and semitendinosus muscles positioned relative to the biceps femoris? Lateral, anterior, medial, or posterior? Medial. These muscles form the medial hamstring group, while biceps femoris constitutes the lateral hamstring. How is the femoral nerve positioned relative to the femoral artery? Anterior, lateral, medial, or posterior? Lateral. Outside the femoral sheath, the nerve lies lateral to the artery in the femoral triangle. What is the relationship between the vastus medialis and vastus lateralis? Anterior, posterior, medial, or lateral? Medial. Vastus medialis forms the medial contour of the thigh, while lateralis creates the lateral sweep. What is the position of the diaphragm in relation to the inferior vena cava? Posterior, superior, inferior, or anterior? Superior. The inferior vena cava passes through the diaphragm's central tendon at T8, so the diaphragm is located below this part of the vessel. How is the sigmoid colon positioned relative to the rectum? Posterior, anterior, superior, or inferior? Superior. The sigmoid colon descends into the pelvis and becomes continuous with the rectum at S3 level. What is the position of the brachioradialis relative to the pronator teres? Medial, deep, lateral, or superficial? Lateral. Brachioradialis forms the lateral border of the cubital fossa, with pronator teres forming the medial border. How is the inferior gluteal nerve positioned relative to the piriformis muscle? Posterior, inferior, superior, or anterior? Inferior. The inferior gluteal nerve exits the pelvis below the piriformis muscle to innervate the gluteus maximus. How are the medial and lateral menisci positioned relative to the tibial plateau? Anterior, posterior, superior, or inferior? Superior. The menisci rest upon the tibial plateau. deepening the articular surface for the femoral condyles. What is the position of the obturator externus relative to the obturator foramen? Inferior, lateral, medial, or superior? Medial. This muscle originates from the external surface of the obturator membrane and surrounding bone. How is the superior articular process positioned relative to the inferior articular process? Posterior, anterior, inferior, or superior? Superior. The superior processes project upward to articulate with the inferior processes of the vertebra above. What is the position of the medial pterygoid plate relative to the lateral pterygoid plate? Lateral, medial, inferior, or superior? Medial. The medial plate projects downward medial to the lateral plate, forming the pterygoid fossa between them. How is the fibular collateral ligament positioned relative to the tibial collateral ligament? Lateral, posterior, medial, or anterior? Lateral. The fibular collateral ligament spans from the lateral epicondyle to the fibular head. How are the superior and inferior articular facets positioned in cervical vertebrae? Posterior, inferior, anterior, or superior? Superior. Superior facets face supero-posteriorly, while inferior facets face infero-anteriorly in cervical vertebrae. What is the position of the radial collateral ligament relative to the annular ligament? Distal, posterior, proximal, or anterior? Proximal. The radial collateral ligament extends from the lateral epicondyle of the humerus and blends with the fibers of the annular ligament, which encircles the radial head more distally. How is the arcuate line positioned relative to the arcuate ligament? Superior, inferior, posterior, or anterior? Inferior. The arcuate line marks the inferior limit of the posterior rectusheath below the arcuate ligament's arch. What is the relationship between the conus medullaris and cauda equina? Anterior, superior, inferior, or posterior? Superior. The conus medullaris forms the tapered terminal end of the spinal cord above the descending nerve roots of the cauda equina. How is the lateral lemniscus positioned relative to the medial lemniscus? Posterior, lateral, medial, or anterior? Lateral. In the brainstem, the lateral lemniscus carries auditory information lateral to the medial lemniscus. What is the relationship between the superior and inferior colliculi? Inferior, anterior, posterior, or superior? Superior. The superior colliculi form the rostral pair of the corpora quadrigemina, involved in visual reflexes. How is the sphenoid sinus positioned relative to the sella turcica? Posterior, superior, anterior, or inferior? Inferior. The sphenoid sinus occupies the body of the sphenoid bone, below the sella turcica's hypophyseal fossa. How are the scala vestibuli and scala tympani positioned? Lateral, medial, inferior, or superior? Superior. These fluid-filled chambers run parallel through the cochlea, with the scala vestibuli above the scala tympani. How is the basilar membrane positioned relative to the tectorial membrane? Medial, inferior, lateral, or superior? Inferior. The basilar membrane supports the organ of Corti, while the tectorial membrane overlies the hair cells. What is the relationship between the incus and stapes? Anterior, distal, proximal, or posterior? Proximal. The incus articulates with the stapes at the incutostapedial joint in the middle ear chain. What is the relationship between the subclavius and subclavian vein? Anterior, inferior, superior, or posterior? Superior. The subclavius muscle lies superior to the subclavian vein, running parallel to the clavicle. What is the position of the vertebral artery relative to the subclavian artery? Inferior, superior, medial, or lateral? Superior. The vertebral artery arises from the superior aspect of the subclavian artery before entering the cervical vertebrae. What is the relationship between the superior and inferior epigastric arteries? Lateral, inferior, medial, or superior? Superior. The superior epigastric artery descends from the internal thoracic, while the inferior ascends from the external iliac. Which plane would pass through both kidneys at once? Frontal, coronal, sagittal, or transverse? Transverse. A transverse plane passes through both kidneys, dividing the body into upper and lower sections. How is the lacunar ligament positioned relative to the pectineal ligament? Inferior, lateral, medial, or superior? Medial. The lacunar ligament forms the medial boundary of the femoral ring adjacent to the pectineal ligament. How is the hepatogastric ligament positioned relative to the hepatoduodenal ligament? Inferior, lateral, superior, or medial? Medial. Within the lesser omentum, the hepatogastric ligament extends medially from the hepatoduodenal ligament toward the stomach and the body's midline. What is the position of the phrenicocholic ligament relative to the spleen? Superior, medial, inferior, or lateral? Inferior. This ligament forms a shelf inferior to the spleen, supporting the splenic flexure of the colon. How are the medial and lateral arcuate ligaments positioned? Medial, lateral, inferior, or superior? Medial. These ligaments arch over the psoas and quadratus lumborum muscles, forming diaphragmatic crura attachments. In the anterior abdominal wall, the median umbilical ligament or urachus remnant is what to the medial umbilical ligaments or umbilical artery remnants? Medial, lateral, superior, or inferior? Medial. The median ligament represents the obliterated urachus, flanked by the medial ligaments from the umbilical arteries. What is the relationship between the gubernaculum and gonadal development? Superior, inferior, posterior, or anterior? Inferior. The gubernaculum guides testicular descent from the abdominal cavity to the scrotum. How are the mesonephric and paramesonephric ducts positioned? Lateral, medial, anterior, or posterior? Lateral. During development, the mesonephric duct lies lateral to the paramesonephric duct and the urogenital ridge. What is the position of the septum primum relative to the septum secundum? Right, left, anterior, or posterior? Left. In atrial development, the septum primum grows toward the endocardial cushions left of the septum secundum. What is the relationship between the frontonasal and maxillary processes? Superior, inferior, lateral, or medial? Superior. The frontonasal process forms the forehead and nose, while maxillary processes create the lateral facial structures. Where are the medial nasal processes located in relation to nasal pits? Lateral, inferior, medial, or superior? Medial. The medial nasal processes lie on the inner side of each nasal pit, while the lateral nasal processes lie on the outer side. When the medial ones fuse at the midline, they form the philtrum and primary palate.